Hello, good evening, everyone. A very warm welcome to the open evening from the entire Herts Essex Fertility family. My name is Praveena Pai. I'm one of the consultants. And joining me, let me see if my slide moves. Here we go. Okay, so what's on the agenda today? I'm going to take you through a presentation which gives you an idea about the journey through our clinic. There will be a question answer session at the end, but we are also taking questions simultaneously. So please feel free as I'm taking you through the journey. If you are coming up with any doubts, questions, keep putting them in our in the chats. Please do stay with us till the end. We've got a special Valentine's offer for you. And also we'd really appreciate if you could take out a minute or two and give us a little feedback. It goes a long way in improving these presentations. And also I'll take you through a clinic, a virtual tour of our clinic, so you get an idea as to how we look. So joining me today at the open evening are my lovely colleagues, Sarah Templeman, she is the Clinic and Nursing Director, and Mana Marks, the Marketing and Wellness Chief. So once again, a very warm welcome, and my name is Praveena Pai. So a little history about Herts Essex. We were founded in 1989. We've got over 36 years of experience, more than 8,000 babies to our credit. All procedures are performed under one roof. So you're not running pillar to post trying to get things done. And this is a really good state-of-the-art purpose-built clinic. We provide a range of services. So we do fertility assessments as for a couple. For individuals, we do gynecological screening. We take you through various treatment options like IUI, IVF, ICSI, PICSI, surrogacy. We are one of the leading national centers for surrogacy. We offer additional treatments like pre-implantation genetic testing of embryos to select the most optimal embryo. We do pregnancy scans, whether these are pregnancies due to our own treatment or standalone pregnancy scans. We offer fertility preservation in the form of egg freezing, sperm freezing. So yes, you'll see that a plethora of treatment options are available in our clinic. So fertility assessment essentially can be divided into three parts, if you like. Couple fertility assessment takes place in 2 visits. Female fertility assessment, again, takes place in 2 visits. A male fertility assessment essentially involves a semen analysis, which includes, in our clinic, we also do something known as a hyaluron binding assay. And this is followed up with a call with an embryologist who will then discuss the results. With regards to the other 2 fertility assessments, the first visit is essentially to see the nurse, have the bloods done, and then afterwards you will see a consultant. The female will have her ultrasound scan, male will have the semen analysis available, and the consultant will look at all the reports and come up with a plan. So as a part of the female assessment, we provide 3D ultrasound scan assessments. So this is coupled with saline infusion sonogram. So as you can see a little picture here, we put a little bit of saline into the cavity, and that gives us nice contrast to pick up small lesions like maybe a polyp or a small fibroid, which may be intruding into the cavity and should not be there, should be sorted before we can commence treatment. We could also do a hycosi, which is, in addition to the saline, we're putting a little bit of dye and making sure that the tubes are working properly. This is particularly important if we are planning, a treatment such as IUI. Fit for fertility, extremely important. We've got a dedicated space on our website. We really believe in the fact that when you are commencing treatment, whether it is a less invasive one like IUI or a bit more interventional like an IVF cycle, you want to put your healthiest versions into this treatment. So we've got lots of information about it on our website. We've also got a dedicated dietitian, Alex, working along with our clinic. She is really good. She gives patient-centered dietary advice. She does virtual sessions. She runs nutritional workshops. So if you feel you need that little extra push to try and maybe get your BMI optimized before you commence a pregnancy journey, you've got her contact details on the website. So what does the treatment pathway look like? Okay, so it all begins with you logging into the fertility consents portal. Login details will be sent to you in advance. There are certain forms that you're expected to complete, upload your passport, any relevant investigations if are available, then you should upload those as well. Then comes a pre-assessment. So this is an in-person appointment. The couple or the individual is brought in, he or she will meet the nurse. Blood tests for AMH and thyroid functions are done. AMH stands for anti-Mullerian hormone. So this is one of the ways we look at some females' ovarian reserve. BMI is measured for both partners. An important thing to remember is if somebody is commencing an IVF cycle, for us to be able to do it under deep sedation and do it safely, cutoff to start anybody on an IVF treatment pathway, the cutoff BMI is 34. So one needs to get below that. And this is also the time where the sperm provider gives us a semen sample so that it can be analyzed and it can be ready so that the consultant can then have a look. Once all these bits and bobs are ready, you will have a consultation with one of the consultants. The consultations generally happen via Microsoft Teams, but if a couple wants to see a consultant face-to-face, that can be arranged as well. This is where the consultant will then have a detailed look at the medical history, any previous investigations, any previous treatments you might have had elsewhere. He or she will then look through your results and then come up with a personalized plan. So once the consultation is over and you've decided on a treatment plan, the next thing we need to arrange are some screening bloods according to the HFEA guidelines. The screening required for all patients include tests such as HIV, hepatitis B, Hep C, chlamydia, gonorrhea. Additional screening for the egg or the uterus provider includes the AMH, which we might have done already, which, as I said, is an ovarian reserve marker. We also need to do rubella, to see if she's rubella immune, a full blood count and HB electrophoresis to rule out situations like sickle cell or thalassemia. The results now, we try and do these tests as close to the start of treatment because they should be within 3 months of starting treatment. So essentially, once these bloods are done, the egg collection should happen within 3 months. Otherwise, they become out of date. And the other thing important is that even if somebody wants to get them done elsewhere, we don't have a problem as long as they are carried out through a UCAS accredited laboratory. So moving on, let's look at a few treatment options. So the first one, which I suppose comes to mind, which you've heard of probably, is intrauterine insemination. So this is a procedure whereby the healthiest available sperm is introduced directly into the womb. IUI is used to help with pregnancy in heterosexual couples where penetrative intercourse may be difficult. It could be a situation where a woman has got vaginismus, or it could be issues with erection or ejaculation in the male partner. And of course, IUI is particularly pertinent for female same-sex couples using donor sperm, essentially that. So let's take you through an IVF treatment pathway, which is a bit longer. So I'm going to dedicate a few slides to this. So IVF stands for in vitro fertilization. That means fertilization is happening outside the body. It starts, usually the journey begins, or rather the treatment begins on day 1, 2, or 3 of the period with what is known as a baseline scan. So in the baseline scan, what we want to look at the ovaries, we want to count the number of follicles. These are the antral follicles. And based on that, we want to start you on certain injections, which are known as the stimulation injections. These are are required to stimulate the ovaries and encourage the follicles to grow. The treatment continues for about 10 to 12 days, after which we plan the egg collection. These injections are generally very well tolerated. Some of the side effects which I must mention are things such as headaches, mood swings, breast tenderness, bloating. In a small percentage of women, particularly those who have got polycystic ovarian syndrome, there is a risk of ovarian hyperstimulation syndrome, which essentially means they end up producing lots of eggs, consequently lots of hormones, and in those situations, the woman can end up feeling quite bloated. But we've got very strict protocols, and generally we are finding that we have kind of reached an era of OHSS free clinics. But as I said, we follow very strict criteria to try and reduce the risk of OHSS significantly. So we've started the stimulation injections. Then comes another scan around day 5 or day 6. Now, this is the scan where we would like to see ovaries looking a bit like this. You can see these dark circles. These are the growing follicles. Okay, so this is to see, are you responding adequately? And this also gives us an idea that if response is looking good, this is the time we start another injection in the mornings. We call that an antagonist, and the drug that we normally use is called cetrotide, and that is to prevent you from ovulating prematurely. So the evening injections, that is the stimulation injections, continue in the evening. Another drug or injection is added in the morning from about day 5, day 6. We continue to monitor your cycle by doing another scan. And the important thing is, after a scan done by the sonographer, you will see the nurse, and that gives you an opportunity to have a little chat about injections. If you've got any concerns, things are not going quite right, you want some tips on how to do things well, you will have that opportunity to address those concerns. What we are also doing is simultaneously looking at the endometrium. So that is, we want to see a beautiful triple line endometrium, because it is telling us that the womb is getting ready for the reception of the embryo. Then comes the final scan. So generally you have about 2, 3, occasionally the 4th scan. On that final scan, we want to see if all the follicles are looking really nice, mature, good size. So once we've noted that, this is when we give you the trigger injection. So let's say the trigger is tonight at 10 p.m. Approximately 36 hours later, that is 10 a.m. day after tomorrow morning, we plan the egg collection. Okay, detailed verbal and written instructions are given as to how to prepare yourself for the egg collection, when to come in, so on and so forth. So on the day of egg collection, you're admitted to the recovery bay. You'll have a whole team looking after you. Baseline observations are done. The male partner goes away to provide a semen sample. The woman gets a chance to meet one of our anesthetists. We've got a lovely bunch working with us, and then the operating surgeon. It could be me on the day, me and the anesthetist, and the whole operating team then wheels you inside the operation theatre. For about 20-30 minutes, you are asleep. The consultant will do a transvaginal collection of the eggs, which is then the eggs are given to the scientists working alongside. They're called the embryologists. They also have the semen sample with them, and they get on with the work needed in the lab. Once the procedure is completed, you're wheeled back into the recovery. Once you've had a nice cup of tea, you've come out of the anesthetic effect, you've passed urine, the consultant comes around to have a chat with you, you come to know what the initial egg number is, and then you're discharged home. Okay, so you're in the clinic on the day for about 3.5 hours. So from here, we move on to the lab. So what goes on in the laboratory? So just to get an understanding, the way we use the days, so day 0 is when the egg collection happens. Day 1, that is 24 hours later, is when we go and check how that egg has fertilized after it's been left with the sperm. So that's called the FERT check. That's the day you will get a call. Day 2, day 3, day 4, not really significant in terms of the information you get, because we try and keep them undisturbed, these fertilized eggs in the blastocyst culture, so you don't get an update. It is day 5, which then becomes really important, because that's the day we bring you in for a fresh embryo transfer. Day 6 is an additional day. So that's the last day till when we keep these embryos. So if you've got any spare embryos which are suitable for freezing, they get frozen on day 5. Any of those which can't be frozen on day 5 but have the potential to grow will be left till day 6 and get frozen on the day. So those are the kind of days that we are important in an IVF cycle. So let's look at day 0 a bit more in detail. What happens? Let's say we've done the egg collection. So these egg collections could be used for just freezing. So if somebody's interested in having fertility preservation and they've come here for egg freezing, that's, as I mentioned earlier, is one of the treatment modalities we offer. So this is a reproductive technique used to preserve fertility. Earlier, we could store eggs for 10 years. Now that limit has been increased to 55 years. the younger the females, the better the quality of eggs. Egg freezing has become really, really talked about in the press. Otherwise, women are coming ahead to do egg freezing either because they just aren't ready to start a family. They may have history of premature menopause in the mother. They may sadly have understood that they've got cancer. They're going to have chemotherapy, and therefore they want to preserve their eggs. Or they may have, a planned surgery for something like endometriosis, which is going to deplete the eggs, and they might want to freeze some eggs beforehand. Counseling is offered before egg freezing, and we are seeing a lot of women coming through for egg freezing these days. So that's one of the things we are doing on day 0. Okay. On the day 0, also those eggs which have been retrieved could be because the couple is undergoing a cycle of IVF. So there are 3 types of treatment we are looking at in IVF. So we've got IVF. If the semen parameters are completely normal, essentially what we do is we get those eggs out, and each egg is left surrounded by millions of sperms. They're left in Petri dishes into the incubator, and then we leave them alone for 24 hours to see what happens, what is the fertilization rate. We select couples for IVF provided their normal semen parameters and there is no previous history of intracytoplasmic sperm injection or ICSI. So that brings me to what is ICSI, and I'll take you through a small video. ICSI is a treatment method which used if we've got sperm parameters not quite meeting the required WHO criteria. So if there is poor count, low motility, more abnormal forms, it could be a situation where there are no sperms and we have to collect sperms directly from the testis. It's called surgical retrieval of sperms. The situation may also arise where we see lots of antibodies in the semen. Consequently, the sperms, they clump to each other and therefore they do not have the ability to penetrate the egg on their own, and they need a hand. Or if it's a situation where a couple comes to me and saying that they've got history of previous failed fertilization following IVF, we counsel them for ICSI. I'm going to see if I can show you a little video. Okay, so yeah, it is working. So ICSI is a fascinating technology. It came about in 1990, started in Italy, and what we find is that when semen parameters are not quite right, the embryologists themselves, under very high magnification, will look at the semen sample. They will find a good-looking sperm, as you can see here. They will immobilize it. They will suck it into this pipette, and then it's taken towards this beautiful egg. The idea is to go and penetrate the zona, the ulema, and then go and leave the sperm directly into the cytoplasm of the egg. You can see the sperm here, and you can see that now being very gently injected into the egg. And once that's done, needle is out, and the egg is released from the egg holding pipette. There we go. Okay. So, and last but not the least, we also perform something known as ICSI, which is physiological ICSI. So if you've got, as I mentioned earlier, when we are doing a semen analysis, we do an additional test called hyaluronate binding assay, which tells us about sperm maturity. And if you find that the sperm maturity is less, then ICSI is an ideal treatment option. So day 0 is over. We've done what we had to do on day 0. 24 hours later, we want to go and do a fertilization check. So that's done by the embryologist. And what they would like to see is a normally fertilized egg, which shows these 2 pronuclei. Occasionally, we may have an abnormally fertilized egg as well, but we want to see more of these, which are then moved into the embryo culture. On day 2, you see a 4-cell embryo. Day 3, we expect it to be around 6 to 8 cells. But again, as I mentioned, we tend not to see them. We don't want to disturb them. They are resting and doing their own development in the blastocyst culture. These are called cleavage stage embryos. So that brings me to day 5. So there are 2 options. If we have counsel with the couple and we feel a fresh transfer is feasible, we prepare the lady by giving her some progesterone pessaries from the day of the egg collection, twice a day, and that way the womb now gets ready for embryo transfer. The couple is invited for the embryo transfer on day 5. The good thing with our clinic is that we offer embryo transfers, fresh embryo transfers, 7 days a week. That way we maximize your chances of pregnancy. You're given an opportunity to see your embryos on a screen, and you're also given a little picture to take away. Embryo transfer happens under ultrasound guidance, and with a slightly full bladder. Once you've emptied your bladder, embryo transfer is done. You were probably in the clinic for about half an hour, 40 minutes. You're allowed to go home. We offer something known as embryo glue as an add-on, because we found that small studies support the use of embryo glue in improving implantation rates. So once the embryo transfer is done, off you go, carry on with your day-to-day activities, and 2 weeks down the line, we'll give you a date to do a urine pregnancy test and give us a ring. This is also the day where, as I mentioned earlier, if the couple has been counseled, then we do additional testing for the embryos. This is known as pre-implantation genetic testing of the embryos. PGTA stands for pre-implantation genetic testing for aneuploidy, and by aneuploidy I mean chromosomal abnormality. So it's a technique for deselecting abnormal embryos, thereby using only euploid or chromosomally normal embryos in a frozen transfer. So consequently, what would have been perhaps a success rate of 35 to 40% in a cycle with a euploid blastocyst, you're now looking at about 60 to 65%. So PGTA has come in a big way in decreasing the time to pregnancy and decreasing significantly the miscarriage risks. We also perform PGTM for monogenic gene disorders such as cystic fibrosis, BRCA, or Huntington's, and PGT-SR screens for chromosomal rearrangements, which is particularly relevant in somebody who's got repeat pregnancy losses. And as I mentioned earlier, this is the day. So let's say we've got a couple, we've done a single blastocyst transfer fresh, and she's perhaps got maybe 2 or 3. 1 in 4 couples will have spare embryos to freeze. So whatever is suitable for freezing will get frozen on day 5. This also includes embryos that were biopsied. They get frozen as well, because results will take a couple of weeks to return. And once the embryo transfer is done, as I mentioned, you will be given medications in the form of progesterone to support the pregnancy. And 2 weeks down the line, you will give us a ring with the urine pregnancy test. If the urine pregnancy test is positive, we then arrange a pregnancy scan at 7 weeks. And what we'd like to see is a beautiful pregnancy sac with a lovely fetal pole and a nice cardiac pulsation. We also offer 10-week scans with the non-invasive prenatal testing, which is called Harmony, to look at, which is one of the earliest ways of looking at certain chromosomal abnormalities like the Down syndrome, trisomy 13 and 18. So that brings me to the end of an IVF pathway. We also do donation cycles. So we've got egg donation and sperm donation happening in our clinics, and we've got dedicated teams looking after this. Egg donation might happen because it may be somebody has had age-related decline in egg numbers. A woman may have gone through early menopause. She may have chemotherapy-related decline in egg numbers and quality. She may be born with poor egg quality. There are women who are born without ovaries, consequently no eggs. And it could be an arrangement in surrogacy, whereby surrogacy essentially means somebody's borrowing the womb. But if I've got, say, same-sex male couples planning a pregnancy, they will also take donated eggs, take their sperms, create the embryo, and then use it in a surrogate. I'll talk about surrogacy in a moment. Sperm donation, again, a treatment modality used in situations where men don't have sperms. They may have lost the ability to produce sperms because of chemotherapy, because of genetic disorders. It could be a case of a single lady desiring a pregnancy using donor sperm. So we've got donated, we've got sperm bank and we've got donated semen samples. It could be a female same-sex couple planning pregnancy using donor sperm. So again, donated sperm samples become quite important. So as I mentioned, surrogacy, with more than 409 cycles completed since 2012, we are one of the leading clinics in the country to offer surrogacy. There is a dedicated surrogacy team for intended parents and surrogates. Many cycles, as I mentioned earlier, also includes an egg donor. Heterosexual couples could be using surrogacy, or it could be a case of male same-sex couples. Single people using their own gametes can also require and use surrogacy. We've got two types of surrogacy, the host surrogacy and straight surrogacy, and we can give you more details if you're interested. Do contact us. What about the funding options? So we offer NHS-funded treatment cycles. So how do you access NHS-funded treatment? We are in partnership with 3 ICBs. We work with the Mid and South Essex, North Central London and North East London. Now your ICB is not determined by where you live, it's determined by the location of your GP. So if you need more information with regards to it, so if you think, look, I've been waiting for NHS funded treatment and I think I've just heard from them, and you feel that why not come to Herts Essex, talk to us and we will help you navigate that process. So Northeast London ICBs include Barking, Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets and Newham. Mid and South Essex ICBs include Mid Essex, Castle Point, Rochford, Basildon, Brentwood, Thurrock and Southend. And the NCL includes Barnet, Camden, Enfield, Haringey and Islington. What if there's no NHS funding? And we understand that an IVF journey can be expensive. We've got some other options. So we do run a couple of programs. One is the egg share scheme and other is the sperm share scheme. To give you an example, if you find that we've got a lady, she's young, less than 35 years of age, she's got good ovarian reserve, she wants to come forth and do her own cycle, but she decides that she is able to also donate to our egg bank, then she would potentially be, she would qualify for an egg share scheme. So we have something similar for the sperm share scheme. In both these schemes, the treatment cycle gets subsidized significantly. Right, and that brings me to the Valentine's special offer. So we've got a 50% discount running for new consultations. If you were to book by 27th February 2026, you will be paying only half of the $275, which is the price for a new consultation. This does not include blood tests and semen analysis. So that's a 50% discount offer if you were to book with us before the 27th of February. We've got other fertility funding options, and again, you can look at the details on the website. We partner with Access Fertility as well as Assured Fertility. So please take a look, and if you have any further questions, feel free to speak with our finance team. Wellness at Herts is taken very seriously. We know it's an arduous journey. We know it can be a roller coaster. Sometimes you get a positive pregnancy test. On the other hand, you come and you find there's nothing happening on the scan. So there are lots of emotions, which are going up and down. And the one thing you'll find is a massive amount of support in our clinic. You'll also find lots of it on our website. So one thing we've often been told by our patients that no matter where the journey ends, it never will be a lonely journey for you. We'll always be with you in this journey. So why us? We've got 36 years of experience. We've got 7-day-a-week lab service. As I said, we offer fresh transfers 7 days a week. We've got electronic witnessing system, so there is no mixing of gametes. There's no fear of mixing of embryos. more than 8,000 babies have been born via this clinic. You will feel supported throughout your treatment journey. And of course, there's free parking. So thank you for staying with us till the end. Please do give us your feedback in the link provided. Follow us. We are there on a lot of social media platforms. If you want to book an appointment, we will leave our number with you. You can also drop us an email at enquiries@hertsesexfertility.com. Once you've contacted us, usually we try and book your new consultation within the next 2 to 4 weeks. I'm sure you've had questions. Please feel free to keep them coming. I will be joining Sarah afterwards, and we will stay till the end and endeavor to answer every question. So once again, thank you very much for joining us for this open evening. And before you go away, I'm going to take you on the virtual tour of the clinic. So please, I'm just going to stop sharing, but do not go away just yet.